Good afternoon, everyone, and welcome to the National Council for Behavioral Health's webinar entitled, I am a parent of a young child with behavior problems, including ADHD. Why do I need training in behavior therapy? The first webinar in our three-part webinar series on evidence-based and evidence-informed parent training in behavior therapy for young children with ADHD. To register for the forthcoming 2 webinars, please visit our link posted here. I want to also acknowledge and thank our funder. This webinar series was made possible with funding through a cooperative agreement with the Centers for Disease Control and Prevention. Hi, my name is Shalina Fodderingham, and I serve as Director of Practice Improvement with the National Council for Behavioral Health here in Washington, D.C. I'll be serving as your moderator for today's webinar. As a parent of a young child with behavior problems, or ADHD, it can be very difficult to find the resources and professional supports you need to help your child while supporting positive child growth and development. As we know all too well, young children with behavior issues not only impact the child, him or herself, but the entire family. In this webinar, parents will learn about parent training in behavior therapy and why it's an important first step for helping young children with behavior problems, including children with ADHD. By being trained by a therapist in behavior therapy, parents can learn parenting strategies that encourage positive behaviors and discourage negative ones. Behavior therapy for young children with ADHD gives parents the knowledge, tools, and skills they need to help their child succeed. This is the very reason that we're here together today, to foster positive child growth and development and healthy families. And we're so thrilled with the response that we've gotten when we announced this webinar. Can you all believe that there's more than 900 of you registered to join us today? Your enthusiastic response has helped to reinforce to us and to the CDC how high the level of need and interest is for this information. We don't want this to be the last time that we interact with you. So at the end of this webinar, a brief evaluation survey will pop up on your screen. Please take a few moments to fill out the survey. We'll be using these results to improve future webinars and to understand any additional information and training needs you may have related to this topic. Before we begin, I'd like to cover a few housekeeping notes. Today's webinar is being recorded and all participants will be kept in listen-only mode. In order to hear today's webinar, you must dial in to the conference line and input your unique passcode, which can both be found on the left side of your GoToWebcast window. Questions may be submitted through the webinar by typing your question into the Q&A pod within your GoToWebcast window and sending it to the organizer. We'll answer as many of your questions as time allows after all speakers have presented. If at any point during the webinar you experience technical difficulties, please call tech support at 888-523-8445. Before I turn it over to our speaker, I'd like to talk about the structure of today's webinar. During the first hour or so, we will hear from our 2 speakers, Drs. Greta Massetti and Dr. Beverly Funderburk. And after they've presented, we'll provide you with an opportunity to ask these experts questions for the remaining 25 minutes or so. As a reminder, you can submit your questions throughout the presentation by typing them into the Q&A pod within your GoToWebcast window. We'll have our faculty answer as many questions as time allows. With that, I'm now pleased to introduce our first presenter, Dr. Greta Massetti. She's the Associate Director for Science in the Division of Cancer Prevention and Control at CDC. She was a scientist for 7 years in the Division of Violence Prevention at CDC, and prior to that was on the faculty at SUNY Buffalo in the Departments of Psychology and Pediatrics. Her research has focused on evidence-based services for children and families with a particular focus on ADHD and disruptive behavior problems. Dr. Massetti has a PhD in clinical psychology from the State University of New York at Stony Brook. She has led numerous studies on evidence-based services for children and families and on community and policy strategies for prevention and health promotion. And with that, we are so pleased to have you with us today, and I'd like to turn it over to Dr. Massetti.
All right. Well, thank you very much, Shalina. This is Greta Massetti. I'm very happy to be here and to present and talk to the audience today. And I'm really glad to have been invited to do this presentation. So my part at this very beginning is going to really be a broad overview on behavior therapy for parents of young children, why it's recommended, and kind of start the process of discussing kind of the frame. And then Dr. Beverly Funderburk is going to take over from there as well. So before I start, I just wanted to mention my disclaimer. I'm here to present on kind of the areas of my expertise, but I don't necessarily represent the views and official position of the CDC. And, you know, as Shalina mentioned in my bio at the beginning, I have done a lot of research in ADHD and disruptive behavior problems. I've worked with a lot of families, and I've done a lot of clinical work, and these are some of my favorite topics to talk about. But I'm also a parent. This is a picture of my children in a rare moment when they appear to be getting along with each other and liking each other. I like to mention the fact that I'm a parent because, I want to communicate that I understand the joys and challenges of raising children in a safe, stable, and nurturing environment and the importance of that. But the reality is that it's not always easy, right? So anyone who's a parent can tell you that parenting is stressful for all parents. All children test limits. They challenge our patience. Children with ADHD and behavior problems are particularly stressful for parents, as all children, especially young children, are impulsive sometimes, and they tantrum sometimes. Children with ADHD and behavior problems they have particular challenges in terms of the frequency of impulsive behavior and tantruming and those kinds of issues. So while it's always maybe an easy thing to think about making the right choice, the patient choice as a parent, it's particularly challenging in managing the day-to-day frustrations when there's so much going on. So really, the question is, how can we help parents make the right choices and give them the skills and tools? So that's where behavior therapy for parents comes in. Essentially, the concept is that behavior therapy for parents give parents the tools they can use to effectively manage their children's challenging behaviors. The key principles behind behavior therapy for parents is that ADHD and behavior problems are often chronic conditions that require a chronic disease model of care. We need to really be thinking about a child's lifespan and how can we help the parents who are responsible for development for that child to build a kind of healthy relationships that will last a lifetime, and they can transfer those skills to their children. The other piece is that what's most important, symptoms are not less important than functional impairment, that really behavior therapy for parents is focused less on what is the diagnosis and more on what are the challenges that a child is having in their day-to-day life, and how can we help parents address those challenges specifically. So it's really about what are the unique experiences of each family and each child, and taking each child as an individual. The other key component is that for behavior therapy is that interventions really need to be evidence-based. There needs to be a science behind it. There's actually research showing that that's what parents prefer, that they want to know that when they are investing their time and often their money into an intervention, that it has a really good solid base behind it, that it's going to be effective for them. One of the things that we often hear from parents when they first hear about behavior therapy for children is, this question of why parents? Why am I being put in therapy? Isn't my child really need to be the one who gets the treatment? And so this is really not about treating the parent versus treating the child, or who's to blame for challenges. It's really about understanding ADHD and behavior problems as a need that parents need to adjust to. So I often like to present a metaphor. If you had if you knew a great chef who is a really fantastic cook, and if that person had a child with diabetes, that chef would need to learn new ways of cooking and managing his or her child's diet in order to make sure that the child is healthy and successful. It does not mean that that chef is any less of a good chef or doesn't know how to cook fantastic food. It just means that that person's child has unique medical needs that need to be adjusted to in order to meet their, to make them live healthy, successful lives. And I think that that's a really important thing to keep in mind for parents of children with ADHD and disruptive behavior problems, because they tend to get blamed a lot. If you were just a little more firm or strict, or didn't spoil them as much, or didn't do this or that, or you fed them different foods, then you wouldn't be having these problems. And it's really not about that. It's really about giving them the tools they need to make their child successful. The reason we are here is because behavior therapy for parents is recommended by a number of professional organizations, most notably the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry. They recommend training parents in behavior therapy for ADHD, particularly for parents of children who are young, 5 and under. These recommendations are based on not just professional opinion, but also on strong scientific evidence that parent training is effective at addressing the behavioral impairments associated with ADHD and child behavior problems. Meaning these are the strategies that help children in their day-to-day lives manage their needs in schools, in play settings, and at home. Both the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry guidelines in particular emphasize that for young children, those ages 4 and 5 and younger, training parents in behavioral therapy should be used first before medication is used. The recommendation states that patients should be monitored, and only if parent training is not effective at addressing all of the behavioral issues, then medication should be started. There are also a lot of interventions and strategies that are often offered to parents that are not evidence-based. Most of the time, these have not been evaluated, so we don't really know whether they're effective. And but sometimes they have been evaluated and they've been found to not be effective. And there are a number of things that parents try, and if things seem to be helping, that's great. That's for them. They can be kind of what we call complementary strategies, and that these may work for some families as an add-on. But what's recommended really is behavior therapy for parents. So, what does behavior therapy for parents look like, and how does it differ from other strategies? It can vary in how it is delivered, but essentially the approach for behavior therapy for parents is very similar across programs. The real focus is on building skills for positive parent-child relationships, and in helping parents build those useful skills and apply them in their day-to-day interactions with their children. So we want to help parents feel competent. It is often a clinician-guided approach, meaning the clinician serves as like a coach for families and helps them understand kind of how to use different skills, use a problem-solving approach to really identify, okay, what are the issues that you're having in day-to-day? What are the areas where you're struggling? Is it bedtime? Is it meal times? Is it sibling rivalries? And how do we really dig into that situation and understand how do you learn the types of skills that will kind of smooth over some of those rough spots. It can be group-based or individual family-based, and oftentimes both can be really effective depending on the needs and preferences for parents, and some families like one-on-one attention, and some like to meet other people who are struggling with the same types of questions and issues. As I mentioned, some of the key objectives of behavior therapy for parents is really to focus on increasing positive nurturing parenting, helping families have more positive relationships and positive interactions with each other, and decreasing negative or less effective parenting strategies that kind of increase conflict and tension in the family but don't necessarily result in children being less impulsive or having less negative behaviors. Another key core component is to be consistent and helping parents use the same strategies over time because that's what's going to be most effective. And to build parent self-confidence and helping them feel like, okay, well maybe that didn't work this time, but I'm going to keep trying and we're on the right track. As I mentioned, positive parenting is one of the core components, and really that is the foundation of behavioral parent training. It emphasizes positive relationships while using strategies to discourage misbehavior, minimize tantrums and meltdowns, and really helping parents respond positively and sensitively to their child's needs, while also learning to set limits consistently and calmly so that we avoid outbursts and frustrations. So now in the next few slides, I'm going to go over some of the structure of parent training. And I like to use a pyramid approach because I feel like it conveys visually pretty nicely the behavioral parenting approach. Now, oftentimes, behavioral parent training starts with teaching parents positive strategies. And it can seem counterintuitive to a lot of families. They often turn to therapy because they feel like they need help with setting limits and managing misbehavior. They're saying, my child is struggling with bedtime, or I'm getting into a lot of fights with my child over this or that. So they want to learn, how do I do discipline right? And yet parent training often starts with having parents play with their child. And this is a critical starting point because the foundation of parenting really is built on strong relationships. Parents need those relationships as the base of their toolbox for those times when they have to set limits and give consequences. So a lot of times, giving consequences and setting limits, if it's not based on this foundation of a positive relationship, is not going to be effective because the child just doesn't care, really. They're most motivated to get the attention of parents, and they will get it any way they want. And if they're only getting it because they're acting up, then that's what they'll use. But if they have lots of opportunities to get parents' attention by bonding and playing and making the right choices as a child, then it's less valuable to get their attention by acting up. Often parents have gotten to the point where they have not invested time in those relationships because it can be really a struggle. So their children are really acting up because of that attention. So we spend time at the beginning of parent training really teaching parents to play with their child without having to give too much structure, and really engaging and encouraging parents and children to rebuild those relationships. The second level of the pyramid is where we encourage parents to use things like labeled praise. Oh, I really like the way you cleaned up when I asked you to, or I really like the way that you said something nice to your brother or sister. So it's about then how do you use some of those positive strategies strategically to increase the behaviors that you want. The next step in behavioral parenting is effective limit setting, learning how to use things like routines and rules and consistency. So I'm going to give you some examples of these kinds of things. This is things like setting up house rules, and this is one example. Be a good listener, cooperate, use gentle hands and words, no whining. These are just kind of the foundation. Okay, we have structure in our family, we have structure in our lives. It could be things like routines. When parents are struggling with bedtime, that's one of the first things we start with, is coming up with a consistent routine so that there can be the child knows this is what to expect every single night, and then the parent knows how to handle things day in and day out. It can involve planning for challenging situations, something like, the parent knows that whenever they go to take a child to the grocery store, that child has a tendency to ask for treats or toys, and that if they don't get them, they have a tantrum. And so how do you plan ahead to figure out how you're going to handle that to try to get around what is often an opportunity to devolve, for a situation to devolve. The next step as we move up, now this is all, because it's a pyramid and we're working from the bottom up, these are all skills that build on each other. So once this really kind of the foundation is that parents master each set of skills before they move on to the next skills. And I believe Dr. Funderburk is going to really address that in the next presentation as well. But at next, the parents are taught more structured rules like ignoring, distracting, and redirecting. And these are the kinds of skills where parents are really taught, what are the things, how can we help you pick your battles so you're not getting into fights over everything? But what are the minor things that we can just let go, and how can we ignore some of those behaviors? Another key set of skills is using effective commands and instructions. So if a parent is struggling because they're asking their child, they feel like, I told him to clean up his toys 1,000 times and he never does it and he never listened to me, how can we maybe take a look at how you're asking, and can we figure out a way to make sure that you're giving that child the best possible chance of complying with your commands? So are your commands simple? Are they direct? Do they tell a child exactly what they need to do, or do they understand them? Are they paying attention to you, or are they kind of all over the place? Some of the other key skills are avoiding over-talking. Oftentimes I find with families that there's a lot of begging and dialogue and discussion, and sometimes children just need a very simple instruction, and that's what is going to give them the best opportunity to follow instructions. Other strategies parents learn here is things like warnings and when then, if then, or if then statements, like if you do this, then you can have this, and lots of consistency throughout. So then the last part really is where parents learn kind of that concept of discipline. What are the consequences that you can use when children misbehave? That's when you've exhausted all of your other tools, then you turn to logical consequences. Logical consequences are those that are put in place to match the misbehavior. So, for example, if my son leaves his bicycle outside even though I told him to put it away, the logical consequence might be to take it away for a week to reinforce the concept that he needs to take care of his belongings. And if he doesn't take care of his belongings, he's not going to be able to play with them for a little bit. Timeout is a very specific tool. I'm sure a lot of people have heard about the concept of timeout. It's a very specific tool that is used for specific misbehaviors. I don't have time to go into timeout too much here because it's really a skill that needs to be learned very specifically and has a chance to not work very well when parents kind of aren't using it in the right context. But it is, the way I like to describe it is that timeout is a formal way to ignore misbehavior, right? That it's kind of a structured way to use ignoring. And the other idea, the big picture view of behavioral parenting is that, again, this is a pyramid for a reason. The idea is that there is no cost to building positive parent-child relationships, using praise, and those can be used as much as possible. Parents are, the more they use those, the less they need the top of the pyramid. And then oftentimes when I've had parents who really are struggling and they're like, things are going well, and then all of a sudden the last few months, we've really been struggling. Sometimes it's because they're forgetting to pay attention to the bottom of their pyramid, right? They're not, those positive parent-child interactions are kind of like money in a piggy bank. And if your piggy bank is empty, then it doesn't matter how many consequences you try. The child's like, I don't really care. Give me a consequence or not. At least I'm getting attention, right? So oftentimes, that is a dead giveaway that some investment in building positive relationships is warranted, that you really need to kind of go back to building that bottom of that pyramid and having that strong foundation for parents and kids. So that's kind of the big picture view of behavioral parenting. The idea for this, the overall approach is that parents are trying to build a toolbox that will last a long time. So as children grow older and they kind of come up with new challenges or new issues, that the parents have a tool that they can look to and say, what do we need to do here? What is a challenge? Are we not spending enough time bonding with our child? Do we need to have a new set of rules? I know for my children, we hit a snag a few years ago when we were having a lot of mealtime behaviors, and we analyzed it and said, you know what, we need mealtime rules, and we need to be really clear about what our expectations. I feel like we've gotten to this point where we're struggling during dinner, and am I really 100% sure that my children know what it means to have good manners? Maybe that's what we need to do first, is to really build those skills in terms of knowing how to have a good mealtime. So it's kind of this idea of having, being able to use a problem-solving approach. Another thing that's important is not, families need to not waste time on self-blame. It's not about, whose fault it is. It's really about how do we get on the right track as a family. And families often need boosters. Sometimes new things emerge, new challenges, new teachers, new peers, new situations. And sometimes parents need to be able to talk things through with somebody and say, oh, okay, well, how do we get back on track? Some of the key benefits of behavioral therapy for parents is really building strong parent-child relationships, and at the end of the day, that is what everybody wants. That's really something that can build a strong foundation for family life over time. Before I wrap up, I want to point out some of the key resources that are located on the CDC website. There are links to finding therapists and what parents can expect and other information on there. I also want to give a shout out to the National Research Center on ADHD. They have information and webinars on many topics related to ADHD and treatment. That information can be found on either CHADD.org, CHADD.org, or help4ADHD.org. That's help, the number 4ADHD.org. So in addition to those resources on the CDC website listed on this slide, those are another place to look for things. So I just wanted to thank everybody for your time today. My email address is posted there if you'd like to contact me. I'm happy to respond to any email requests. And I'm going to turn it over at this time to Beverly Funderburg, who's going to share additional details about parent training, what it looks like, and where to find services. Thank you very much.
Great. Thank you so much, Greta. And I will, and throughout the presentation, please don't forget to type in your questions into the Q&A box, and we will get to those questions after Dr. Funderburg speaks. So now I'd like to introduce you to the next speaker, Dr. Beverly Funderburg. She's a professor of research at the University of Oklahoma Health Sciences Center's Department of Pediatrics. She conducts treatment and training in parent-child interaction therapy, also known as PCIT. Dr. Funderburg's research interests include issues of training and dissemination in PCIT and cultural applications of PCIT. She is a member of the Board of Directors of PCIT International and is active in developing treatment and training materials and methods to promote the adoption and application of PCIT in a variety of settings. She's a certified PCIT master trainer through PCIT International. Dr. Funderburg, thank you so much for being with us today. We're all looking forward to hearing what you have to share with us. Let me now turn the microphone over to you.
Hi, thank you so much, and I'm very excited to be able to take part in this webinar. I'll start with a little housekeeping. Just like Greta, I'm a parent. I hope I'm not disqualifying myself as a parenting expert by showing you how my children behave when we take a family portrait, but there they are, the three of them. And I also want to offer a disclosure that I'm speaking for myself and not as a representative of the Centers for Disease Control. I also, how many times did you hear PCIT said in my introduction? I am a co-author of the Parent-Child Interaction Therapy Treatment Protocol, and as such, receive royalty, so I want to note that disclaimer. That said, what I want to do is try to give you a little picture of what it would be like if you participate in behavioral parent training. First of all, who provides behavioral parent training? Usually the person that you would work with if you were to participate in behavioral parent training would be a master's level or a PhD level mental health provider who has experience working with children and families. This might be a psychologist, it might be a social worker, or a licensed professional counselor. Medical doctors, which includes psychiatrists who can prescribe medication, are not typically providers for behavioral parent training, although oftentimes they work closely together. The two professions ideally will be coordinating things together. What will it look like? If you've participated in traditional talk therapy, it won't look much like that at all. Participating in behavioral parent training does not mean that your child needs therapy, and it does not mean that you need therapy. Just like the whole rest of the population, you may or may not to deal with particular things. But what parent training is about is working with the parent and the child together in the ways that Greta has really described very well. You would participate in a place that would look probably something like this. You get to play. It'll be a child-friendly space with toys, and it should, of course, this is my topic that I love, so I'm telling you it should be fun. It will be work, but it should be fun as well. And of course, I'm biased because I love my work. The sessions, though, will be in a kid-friendly space, and it might be crowded like the bottom picture there, or it might be sort of stripped down because the clinician might limit distractions or put out just particular toys or activities to target particular skills. There is an emphasis on building skills. So you will be practicing skills and not just sitting and talking about skills. This will be under the guidance of a clinician who has a set of proven techniques that they'll be sharing with you. You may participate in a group with other families. Again, Greta mentioned this. There are many benefits to be gained from a parenting group. There's the support. There's learning from other families. Those sessions, if you're in a group, sessions will usually last maybe an hour and a half to 2, and all the behavior parent training treatments usually occur once a week. Treatment might range from 8 weeks for a prevention program for milder problems, or if you simply want to enhance your parenting skills, up to as much as 24 weeks. You should expect to have an intake appointment of perhaps 2 to 3 hours, which may be spread over several sessions or done all at once, where you'll be asked to talk to a mental health provider about your family situation, describe the nature of your concerns. You'll probably be asked to fill out some forms or questionnaires about your child and about your family, and you may even be asked to play with your child in several different situations in order for the clinician to be able to see how your child's behavior is alike or different from other children in the same age and developmental level in similar situations. So it gives your clinician, you want a full picture in order to determine if this is the right treatment for you. Following your assessment, if behavior parent training is recommended and if you decide to participate, you should plan on 4 to 6 months of weekly sessions, and that's if you attend regularly and participate fully. Of course, spotty attendance or not practicing would slow down progress, as in everything. You might participate in an individual setting, just your family with a clinician, which also has benefits where, as I think Greta said, you'll be getting the full attention. Sometimes it's offered, the treatment that I do, parent-child interaction therapy, has a coach who coaches from behind a one-way mirror as the parent plays with the child. So at the bottom of that slide, you can see the parent has a little microphone in their ear, and the therapist is coaching them as they play with their child. So the child is very focused on playing with their parent and not so much on the counseling situation. In the group treatments, you're likely to discuss a skill, to watch video clips, to see demonstrations of skills. You will role play and practice skills, and then you will take those and practice them with your own child. Why do I have to do it? Why you, the parent, and not me, the counselor? It's because you are the most important person in the child's life. Parents have the greatest influence on the young child's behavior, and only therapy that focuses on training the parents is recommended for very young children with ADHD, because young children are not really mature enough to change their own behavior without support from their parents. Another thing that I want to mention that's very important to understand is that behavioral parent training is teaching you a specialized set of skills. It's not teaching you to do what everyone else already figured out but you just didn't think of. It's not the standard parenting that everyone is just automatically doing. It's a special set of skills that have been developed for children with behavioral issues, including symptoms of ADHD, or for families who are experiencing difficulties due to any particular stress or circumstances. So if your child is having problems, it doesn't mean that you're a bad parent or that you caused your child to have ADHD or any kind of behavior problems. Behavior parent training, and Greta already said this, but I'm going to reiterate it, behavior parent training focuses on how to improve your current situation rather than on assigning blame for how things came to be. There will be homework. Did I mention that already? There will definitely be homework. You will learn skills in session and you will practice them at home. you should plan on setting aside daily time to practice the relationship, those positive attention skills, and then gradually you will incorporate the discipline skills until you've built that nice triangle that Greta described with a very strong base of positive skills and then a toolbox of behavior management techniques for every situation that you encounter. I want to refer back just for a moment to that diabetes analogy where sometimes parents say, all I do is pay attention to this child. They demand my attention every waking moment and all through the night, and sometimes I get called away from work or over to school for more of my attention. We know that. And the reason for the daily practice, you can think of it as that child's dose. You wouldn't say to a diabetic, oh, your blood sugars were really bad today, so I'm not going to give you your insulin. They need their treatment, and the parent, in many ways, is the agent of change who's providing the treatment. The other thing is that you are practicing your skills. And just like I never became a very good piano player because I only practiced during the 1 hour a week that I sat with my teacher and not in between. You need to practice every day at home, and that way you will really, really develop your skills. Because essentially what you're doing oftentimes is changing habits. Can you see that cartoon? The dad says, listen up and listen good because I'm only going to say this 1,000,000 times. Sometimes as a parent we feel like we're broken records and we just get stuck nagging our kids. And behavior parent training is about changing those kind of habits that are easy to fall into. The different brands, I guess, of parent training may differ in terminology or in the format, like whether you're meeting with a group or whether you're being coached individually, but we all cover the same basic principles and break down the skills in a way that parents can apply them for children who, for whatever reason, haven't just naturally developed the desired behaviors. Most of you have called in to this because you're interested in ADHD symptoms, but if you think broadly, we all have things that we're better at and come naturally to us and things that are something of a struggle. One of my children, spelling came so easy to him. He would go in for his elementary school spelling test every Friday. He could glance over the words and then he could get his 90 or 100. He just got it. Oh my goodness, my daughter, whatever pathway it is in your brain that makes you a good speller, she didn't get that. And we would start on Monday going over her spelling words Monday night when they came home in her backpack, and then we practice it Tuesday morning and Tuesday afternoon and Tuesday night and so forth and so on. And oftentimes by Friday we had her where she needed to be, but and she is now, she's an honors student. She's doing great, but that didn't come naturally to her. She had to work on it. And behavioral parent training really gives you some tools to work on things with your child that maybe is not developing very easily, and there are things that sometimes we haven't thought about ways. How do you teach someone to be patient, or how do you teach someone to interact well with others? So I'm going to show you a little example here. I'm not going to try to teach you behavior parent training in 30 minutes or less. Great reflection and following his lead beautifully. It's hard to describe everything. You know, you're knocking yourself silly now. It's a hard thing to describe or praise. But you got in some praises and some reflections anyway. I want you now to just turn to the table and say, whoa, I want to see what other stuff they have here.
I'm going to see what else they have to play with right here.
Oh, I'm going to see, I think these cars all hooked together. I bet I can put them in a long train.
But I can put these cars into a big train so they can all play together.
And there he is. You can put your arm around him and guide him back over into a chair if he likes and find some more carts. I'm going to see if they have any more things, carts for the train.
But they have more stuff around here to put off the train.
Oh, and I like the way you landed the airplane, too.
So that was a good job landing there.
Nice little praise. And what I want you to know is that, to start off with, I was just watching this dad play with his child. They've been practicing at home, and I'm watching them play. And I think it's a good example of why sometimes you need a coach, because this dad's trying to say good things and play well with his child, and what this child was doing was a combination of seeing if he could break the ceiling panels by throwing the toys up at the ceiling, or knocking himself down by running into the wall. So I watched to get a sense of how I might be able to help, and then I'm going to coach just a little bit. Okay. Great reflection and following his lead beautifully. It's hard to describe everything. You know, you're knocking yourself silly now. It's a hard thing to describe or praise. But you got in some praises and some reflections anyway. I want you now to just turn to the table and say, whoa, I want to see what other stuff they have here.
I'm going to see what else they have to play with right here.
Oh, I'm going to see, I think these cars all hooked together. I bet I can put them in a long train.
But I can put these cars into a big train so they can all play together.
And there he is. You can put your arm around him and guide him back over into a chair if he likes and find some more carts. I'm going to see if they have any more things, carts for the train.
But they have more stuff around here to put off the train.
Oh, and I like the way you landed the airplane, too.
So that was a good job landing there.
Nice little praise. Thank you. Okay, now you're getting ready to give it back over to me, right?
All right, Beverly, you should have control of the slides now.
Okay, I'm still seeing the picture of the two videos rather than my next button. Let's see.
Just click on the Slides tab to up above the slides.
Okay.
Yep.
Okay, thank you so much. Okay, so I'm going to go back to that for a minute. So I just wanted you to notice how easily that was a very impulsive and distractible child, but we could use that to our favor, because as soon as the dad just started focusing on the toys, the child was right back there, and then the dad was able to apply those good skills that he was practicing on. And again, that's just a moment. It's not to say, oh, this is a miracle cure. But those are some of the techniques that a coach or trainer can help you with. Now, I want to show you just another little example of the kind of changes that you see with behavior parent training. Here is a drawing that was done by a child. They were asked to draw a Christmas tree. This is the first drawing of the Christmas tree. And then here's a drawing where the parent was describing everything that the child was doing. Same day. So just as holding back your attention from negative behavior can be effective, you will also learn skills that are going to help your child succeed at school and at home and in getting along with others. And I think that most of us parents love to learn some concrete skills that we can use to make positive improvements for our child. Okay, I also, though, I think would be remiss if I didn't talk about the tip of that pyramid that Greta mentioned, time out. I know there's a lot in the popular media about time out, and again, as Greta said, I could spend hours talking about time out, and actually in behavioral parent training, we do spend quite a bit of time working on that. Not because it's the answer to everything, because it's a tiny tip of the iceberg that is used very sparingly. But nevertheless, most people who are on this webinar probably would say, timeout doesn't work for my child. I've been doing this work for over 20 years, and I can't remember hardly any parents who've come to me that said, oh, timeout works great for us. Why would they come to me if that were working great? So what the process is of behavior parent training is closing up the loopholes that children have discovered that make timeout not work. Like, what if I won't sit on the step or in the corner or on the chair? What if I throw the chair at you, in fact? What if I say I'm sorry and I won't do it anymore? What if I scream and run around like crazy? There are all sorts of things that kids will do, and all the behavioral parent training programs involve finding ways, first, to set the stage for more positive cooperative behavior, which is the bottom of the pyramid, then setting up effective discipline, structure and routine and techniques that make it more likely that your child is going to cooperate, and then partnering with the parent to close up those last loopholes that are making their current ways of discipline ineffective. Okay, I'm going to show you now a slide of a little clip that shows me coaching a father as his little girl is learning to sit in timeout. Again, this is not the answer to everyone, but it's just a little sample of one family's journey and how the clinician partners with the parent to practice the skills that are going to work for their child. So I'm going to go to the next slide, and we're going to play it, so everybody get ready to turn on your sound.
I'm just going to sit here on the chair until it's over. And they learn that if they just be quiet, it will be over soon. So it becomes a very easy, routine thing. And it's not that it's not effective, because it's very effective, but kids just decide that they'd rather avoid it or else get it over with quickly. Now, we're over 2 minutes. We've got about 30 seconds to go. She's doing really great. She's doing a terrific job. She's learning very, very well.
What? I'm talking, Mommy.
Okay. 10 more seconds, and then we're going to start listening for 5 seconds of silence. Then you'll go over and you'll say, are you ready to clean up the paper now? Okay. We're waiting for our silence now. 1, 2, 3, 4, 5. Good. Now that you're quiet.
Now that you're quiet,
Are you ready to
are you
clean up
ready
your
to
paper?
clean up your papers?
No. I'm not ready.
Hold out your hand and see if she wants to come. Otherwise, say stay there until I tell you to get off.
I'm coming in.
Okay, so you can see that there was just a joint work there between the coach and the parent. When you're working with a child, or when you're a parent to a child who is having some behavioral problems, you go through your assessment, in addition to talking about ADHD, you might hear phrases like oppositional defiant disorder or conduct disorder, and these are all with ADHD known as disruptive behavior disorders. And in young children who have ADHD symptoms, oftentimes they also have co-occurring oppositional or disobedient, non-compliant behaviors, temper tantrums, and aggression. And sometimes it can make it hard to know whether exactly what's going on, and behavioral parent training can help with that. You might say, well, if my child has ADHD, why not just use medication? Because we know that medication can be very effective. But as I mentioned, the symptoms of ADHD can get very mixed up with oppositional or defiant behavior. Also, anxiety or trauma symptoms, or even simple lack of sleep, can also cause poor concentration or overactivity and restlessness that can resemble ADHD. So for young children, behavior parent training can kind of help sort out what's underlying the child's behavior. For example, if you could get your child to obey well enough that you weren't spending 3 hours trying to put them to bed every night, putting them back and putting them back and putting them back and putting them back, if that child could learn to obey and then they could get a good night's sleep, then we could sort of sort out what's going on with that. And a child who's overactive or highly active but cooperative might still be able to cooperate well with adults and get on well with peers. Sometimes you find that they don't need medication. Sometimes they may delay the need for medication, and sometimes it may work well in concert with medication. So that's why the American Academy of Pediatrics is recommending that for children under the age of 6, we start with behavioral parent training, and that kind of helps us sort out what's going on. Who should participate in behavioral parent training? Engaging multiple caregivers and extended family helps to increase the impact of behavior therapy, because everyone who's important to the child can work together to support the child. So it's excellent. I love to have grandmas, parents, babysitters, nannies, everyone who cares about the child. It's great to have them all involved. If it happens that you're a single parent or that you don't have the support of other family members, you and your child still can definitely benefit from behavioral parent training. In some of the behavioral parent training programs, PCIT, my program, for example, we start out working one-on-one. So I might have the parent work just with the child or play just with the child while the other parent observes, and then they'll switch places. And then as we master the skills in this sort of calmed down environment, then we start to add in more components, bringing in the siblings and bringing in a little bit, working our way up to the chaos that is often family life. So we want to involve all the caregivers, but it may be in a particular order that's done. How much does behavior parent training cost? A little hard to say, because it can vary according to different states, according to your insurance coverage or health care, and by the credentialing level of the provider. Some universities that have training centers for the evidence-based program may offer sliding scales. The best thing I can say is that when you're considering behavior parent training, talk to your referring physician and talk to your counselor frankly, about and talk to your insurance provider about the cost for the program. It's often billed as family therapy with child present, but in some cases it's billed as individual therapy in the child's name. How will you know if it's working? It's important that you feel comfortable with your provider. You should be comfortable and feel very free to ask questions and to know that they're interested in you and your child. You should start to see some changes within a month if you're doing your homework and attending regularly. Then just, remember that these problems didn't start overnight. It usually took a while to get into the fix that you're in, and it's going to take some time to make improvements. So, but as I said, you want to find a provider that you're comfortable with. Some questions that you might ask of a provider are things like, explain how you work with parents and what can parents expect. And we've already been talking about how it should mention using the core components that we've talked about of positive behavior and structure, and that it should involve building skills and you working with your child. Do you teach parents skills and strategies that use positive reinforcement, structure, and consistent discipline? Will I learn positive ways to interact and communicate with my child? Do you assign activities for parents to practice with their child? Do you meet regularly with the family to monitor progress and provide coaching and support? And will you readjust and evaluate how things are coming along and be flexible enough to adjust as needed? So all of those are good questions to talk about with your provider. Some of the evidence-based programs that I've been describing include parent-child interaction therapy, the Incredible Years, Triple P, which is the Positive Parenting Program, and there's one called New Forest Parenting Program. All of these have websites and information online, which would be a good place to have a look. But there might not be one of these sanctioned programs in your area. There might be other programs that are very good but haven't had research done yet. So the programs that we're highlighting are ones that have been well researched and share the common elements that we've discussed: skills building, positive parenting, and consistent behavior management. If you can't find a program in your area specifically, you can talk to your provider, ask some of those questions that I was talking about, and find a provider who is knowledgeable about and interested in these programs. I keep saying behavioral parent training. You also might hear it called just parent training or behavior management training for parents, parent behavior therapy. Any of those sorts of approaches may be helpful. Greta provided some resources from the cdc.gov website that can help you find a provider. That website's very, very rich in resources. I like it very much. So if you go to cdc.gov and shop around, there's the ADHD homepage, and another section is called Essentials for Parenting with a lot of great resources. Also, on that ADHD homepage, you can find directories of providers through, like, the American Psychological Association, the National Association of Social Work, and others that can help you locate a qualified provider. I mentioned that some of the actual evidence-based practices will have websites, and you could also talk with your health provider. All good sources to find help. Thank you so much for your attention, and I think now Shalina is going to help us get through some questions and answers.
Great. Thank you so much, Dr. Funderburk. That was a very informative presentation. Before we move to question and answer portion of our webinar, I want to remind everyone that the recording and the slides from this webinar will be available on our website within 48 hours. You can access the recording and slides at the web link provided on your screen. You can also right-click directly on your screen to access the link. So I'm going to go into some questions now. I have quite a few. So the first question for either Greta or Beverly or both of you: how do I appropriately respond to my child engaging in poor behavior while they're out of my care, such as while they're at daycare or school?
This is Greta. I guess I can get started, and I would love for Beverly to weigh in as well. So, you know, that is a real challenge, right? Because a lot of the skills that we talked about involve the parent building the skills, but it's, you know, how do you get other people to learn the skills as well? So in a parent training approach, what would happen typically is that, you know, a therapist or a coach would work with a parent, and if there's, you know, sometimes, you know, parents can build skills enough so that the child gets on track and those behaviors transfer also in a daycare setting or in a school setting, but oftentimes that's not enough. So then a coach would work with the parents to possibly go into the other settings and, you know, train a teacher or a daycare provider to use some of those skills. Now, the training for those providers or those teachers is not nearly as intensive of what you would do with a parent, just because they don't often have the time. But, you know, it might involve putting in place some key structures or components that can help transfer some of those behavioral improvements from the home setting to outside settings. But that's a real challenge. Beverly, did you have anything to add?
I'll quickly add my 2 cents. That's a really kind of a gnarly problem, I think, and I agree with all that Greta said. I'll note that a lot of times as children start to break down those habits of seeking negative attention and just kind of knee-jerk opposition in the home, they start to become more pleasant and more cooperative, and you will start to see behaviors improve in other settings. When that is not happening, or you haven't got to that point in treatment yet, I would note that I think it's important for the home to reinforce what's going on at school, but I don't think you want to get into the trap of punishing a lot. The child had a bad day at school, they were in trouble all day at school, so then they get home or at daycare, then they're in trouble at home. I think that a mild, happy consequence at home, like a sticker or a hug, is good for a good day, and something mild for a bad day, but not like you don't get your sticker, but not getting really sucked into that trap. Ideally, the school will be well prepared to deal with the child's behavior at school well, and the home will be supporting it.
Great, thank you. So the next question, and this is for either Greta or Beverly: how are the strategies that you referenced different from a program they're listing here as positive discipline? Are either of you familiar with that program called Positive Discipline? They were just wondering how the strategies that we referenced are different from that program.
I'm so sorry to say that I do not know that program in any detail that would be sufficient for me to comment.
Yeah, this is Greta. I'm also not intimately familiar. I've heard of Positive Discipline, but I have not. I don't know it very in detail. But I will reference back to what Beverly said, which is a really important message when she was talking about, you know, she named a few programs that have been strong evidence for young kids with ADHD and behavioral problems. And what she mentioned is that they look a little different, but the foundational skills are very similar. There's other programs as well that have a lot of those same skills. They have there's a strong foundation in building positive relationships. You learn a little bit of structure, and so these things are not unique to any single program. So it may be that positive discipline has a lot of the same foundations, and it could be that a lot of times it's really about how they're delivered, and if they're delivered with quality, and they really work with parents to adapt those skills to their day-to-day needs.
Great, thank you. And the next question, what can we do when a parent is not ready or willing to offer play, attention, and encouragement?
This is Beverly. I think that that's a big question. I think that we always have to look at what's underlying that. Is that parent exhausted? Are they perhaps misguided in thinking? Most parents usually want what's best for their child, and they're using the techniques that they think will the best that they know, what their parents did, or what their neighbor told them, or what occurs to them. And if the parent is not ready to engage with the child in a positive way, I'd want to look at what's underlying that, and address what is the underlying issue. Because in my experience, even working with parents who have a history of abuse or neglect, it's usually that they're lacking techniques or understanding rather than lacking regard for their child.
Great. Thank you. So the next question, can this be applied to adolescent clients in a residential setting as well, or is this strictly an adult parenting group? And I'm thinking the parent being an adolescent versus an adult.
I think maybe Beverly can speak to kind of how much the PCIT certainly has been used, but there's been a number of studies with looking at these types of programs with different populations: single mothers, two-parent families after a divorce, teen moms, children who live with grandparents instead of parents. And, these are, as we mentioned a lot, these are the kinds of skills that really can transfer to anybody. There may be some unique challenges if a parent is living in a residential setting, just in terms of kind of how the home environment looks like, but they can certainly be transferred. These strategies can be transferred to those settings, I think, fairly easily.
And if people are wondering if some of these techniques can be applied to older children or adolescents, we've been focusing here on the under 6 age range and programs that are applicable to that. But the same concepts of parent training do have programs that extend up for the older age range, again, balancing that same the core components of skills building, positive relationship skills, and clear limit setting.
Okay, thanks, Beverly and Greta. And the next question, are there different protocols for environmental challenges like domestic abuse, divorce, grief, or trauma? So, do you use different strategies in behavioral therapy when environmental challenges like domestic abuse, divorce, grief, or trauma are there or present?
Mm-hmm. In general, the core components are similar, but a lot of times what happens is that when a family first starts working with a therapist or a coach, they will get they will do kind of get the landscape of what's going on and identify, okay, who cares for this child? If it's a divorce setting, there's sometimes two homes and who provides care, and then they can adapt the coaching or the therapy depending on what the unique needs. Now there are some specific issues related to things like domestic abuse or other particular challenges that may also trigger issues of safety and safety planning, and so that is definitely going to be a big consideration that wouldn't necessarily adapt the skills, but that there may be additional discussions that need to happen just to make sure that safety is priority one, that's ensured in the therapy setting.
Great, thank you. And also, we had a few questions related to time out. So I'll ask one of these questions regarding to time out. Can you provide another example or tip on how to make time out more effective?
Again, I would refer you to the Parenting Essentials portion of the cdc.gov website. I think there's some information on there, and it's hard to answer in just a moment. But bottom line, time out should always come with a warning. We oftentimes will say, pick up your toys, pick up your toys. Pick up your toys, pick up your toys. Okay, now I've had it, time out. And how does the child know whether time out is coming after 10 tries because mommy's had a good night's sleep, or after one try because mommy's got company coming and and she's in a hurry? So letting the child know exactly when time out's going to come gives them a chance to avoid it, and having the child return to the original request, I think, is a good thing too. If the child's going to timeout because, say, they wouldn't obey, then it's not pick up your toys. Okay, now go to timeout and I'll pick up your toys. You don't want to get out of anything with timeout. It wants to come back to where it started, so that the child would rather just cooperate to start with rather than going through timeout and then cooperating.
Mm-hmm. The other thing that I would add as well is that the timeout, it's a discipline strategy for the child, but it's also something that's supposed to replace other strategies for the parents, right? So sometimes I find parents who are, they send the child to timeout because of some, they didn't listen and didn't comply, or for some other reason. And then after the timeout, or even during the timeout, there's also a lecture, and I can't believe you did this, and a lot of that. So the idea is, timeout is not a time to get them in front of you so you can lecture the child and do everything else you would have normally done. It's really to replace kind of whatever it is that the parent is doing that might be escalating the situation or reinforcing a behavior. So, the real benefit of working with a therapist or a coach is that they can really take a look at how is timeout being delivered, so they can kind of really smooth out the edges and give the kinds of suggestions that can address, why is it not working well or as well as it could be.
And if I can say one more moment on timeout, it is
Sure.
to remember that it's the very top of the triangle, and what timeout actually is a shortened phrase for time out from positive reinforcement, and you want a lot of good positive things to be going on that the child wants to get back to, and that's what makes time out effective and needing to be rarely used is when it's used sparingly and there's a lot of other good, positive context around it.
Great, thank you. So the next question for either Greta or Beverly or both, how do you implement working with other siblings who may also have behavioral issues to engage cooperatively with each other in appropriate play and interactions?
That's a great question, and it gets at this, so the upside of that is that it gives a parent many more chances to practice the skills, right, because they have more than one child. And it also gives an opportunity to model, right? So if a child is can observe, my mom, my brother or my sister just refused to listen, and they got sent to timeout, and that way they're learning through all of that as well. Now, sometimes it presents unique challenges because it means that the parent, has to juggle more than one kid, and who do I attend to first, and which fire am I putting out? But oftentimes in a coaching or therapy situation, that can be worked out in terms of how the parent works. If it's, in PCIT, I think Beverly can maybe address this, but, you can work with one child at a time or talk about different opportunities to kind of practice with different kids.
Yeah, and I'm, again, most familiar with the PCIT way of it. We like to have the parent practicing at home with all the children, and definitely all the children who are in PCIT age range, doing a one-on-one playtime with each child each day for 5 minutes is my ideal, although I understand that parents have to do what they can do. Finding age-appropriate time to connect with children above or below the age range of PCIT. And so all the siblings should be getting benefit from it. You're teaching parenting skills, and so the parent naturally will be applying these to the other children if all is going well. And then once the parent has mastered the positive skills and the discipline skills, then in PCIT, I say bring all comers, bring me all your kids, and let's coach through what real life looks like. And I think all the programs work towards generalization like that in some ways. Specific skills you can work on are encouraging sharing or turn-taking or pro-social skills. You can pay attention to that and reinforce that and have consequences for the opposite of that in all of the parent management programs. You just have to identify what it is you want to work on, then you can work on it.
Great. Thank you. So the next question is related to inconsistencies in parenting practices. So how do you address inconsistent parenting practices between partners? There's a question that was related to between partners in the same relationship or even between partners in the case where there are step-parents. So what are some effective strategies to address the child's behavior in those situations?
Shall I go, Greta?
Sure, go ahead.
Trying to help the grown-ups take a focus on the child's best interest is your main goal, so that everyone can take a big picture and not try to score points on one another, but to try to figure out what's going to provide the child the best consistency. That's what you're always going for. That's one reason that most of the behavior management programs will like to include different caregivers, all the caregivers, and teaching them the same set of very effective and predictable ways of dealing with behavior. It usually will make the parents will want to do it once they learn them well, because it makes their life easier and it provides consistency for the children. When different households or even people within households can't agree, that's not ideal because it's not consistent for the child. But I can tell you, my children knew that when they went to their grandma's house, they could eat cake for breakfast because she was going to spoil them mercilessly. And they dealt fine with the fact that when they were back in their own home, they weren't going to have cake for breakfast, and we didn't have any dispute about it. So my point is that we want consistency among caregivers, but children can learn even if the caregiver doesn't have control over every adult in that child's environment.
Great. So the next question, so how can you support the school with their consequences for bad behavior if there's no consequence at home? So what types of strategies can you use to kind of support some of the, support negative behavior that the child might be experiencing at school?
So from from a parent perspective, one good important thing to do is to work with the school to come up with a plan and really work with them to say, if a child is misbehaving, they do these kinds of behaviors, this is how we handle it at home, and here's how it works, and here's what we encourage. And that way the teacher has a plan. A lot of times, a conversation with, all teachers, special education teachers, classroom teachers, principals, everybody is involved, so everyone can kind of come together and really develop a good positive behavioral plan. Now, if it's from the school's perspective, if the school's wanting to work on something at school and they feel like they're not getting the support at home, they really just need to focus on that school setting, especially as this webinar is primarily around young kids. The kids who are that young really need the consequences and the positives to follow as closely after the behavior as possible, because if they misbehave during the school day and then the parent is expected to give a consequence that evening, they're not going to make that connection. So it's really about who's right there when it's happening, and how can they be given the tools and the plan to handle it and manage it in the most consistent and positive way possible right when it's happening.
Great, thank you. And here is another question regarding setting, and I think we're going to be having time depending for one more question. How can a parent, utilize these techniques with their children in a foster home? And is it different than, the skills and techniques for others?
Yeah. So there may be unique, so there is at least one program that has had a lot of really good research. It's called, I think the current name of the model is Treatment Foster Care Oregon, and it's based on the same behavioral parent training principles, and that model is really focused on the unique needs of foster families and training foster families and foster kids who are coming from some disruption in their lives, sometimes from a history of trauma. So there may be, it's similar skills, but it's adapted to those unique individuals and settings. So if that is the question around a foster home, I would definitely recommend anyone looking into that model. Certainly anybody in these programs can work with families who are foster families, and it sometimes just means more intense intervention, more sessions, more time, because sometimes there needs to be a lot more time in building those positive relationships, because that is those relationships don't go back a lot of time in history, and so it's about building that base of the pyramid.
And I would add that the core component, I agree with all that you've said, Greta, and the core components of setting up a nurturing environment and that facilitates a warm, trusting relationship, and providing clear guidelines and limits so that the child has a predictable environment are a perfect recipe for making a safe and supportive home, and it applies very well to foster homes.
Great. Thank you so much, Greta and Beverly. That's all the time we have today for questions. Let me again thank our webinar faculty, Dr. Massetti and Dr. Funderburg, for the excellent job they did today. We're so grateful for their expertise and their willingness to share it with us and with all of you in our audience. And again, our gratitude to the CDC for their sponsorship of this webinar series. Before signing off, I would like to remind you that this webinar is a part of a three-part webinar series on evidence-based and evidence-informed parent training and behavior therapy for young children with ADHD, brought to you by the National Council for Behavioral Health. Please join us for our next webinar for primary care providers that will be on Thursday, June 23rd, and our final webinar for licensed clinicians and other therapists will be on Wednesday, June 29th. You can register by clicking on the links now showing on your screen or going to the website listed at the bottom of the slide. Thanks to all of you again for joining us today on our webinar. As you exit the webinar, a survey will pop up on your screen. Please take a few moments to fill out the survey. This gives us an opportunity to learn what your needs are and to identify how we can further improve our webinars. Again, on behalf of the National Council for Behavioral Health, we truly hope that you have found the information provided during today's webinar helpful, and we remain committed to promoting full health and wellness for children and families with ADHD and behavioral challenges. Thank you again, and have a wonderful rest of your day.